יש לנו פה מקרה מעניין של צוואר, וצוואר הוא אזור בעייתי לטיפול. בדרך כלל, אגב, יש דיספרופורציה או דיסקורלציה בין פנים לצוואר. המון פעמים הרבה נשים וגברים מגיעים, הפנים מטופלות והצוואר מסגיר את הגיל. אני חושב שהצוואר הוא בעייתי יותר לטיפול, מכיוון שבצוואר יש פחות אדנקסה, פחות בלוטות שהן בלוטות חלב, והמשמעות שהן פחות בלוטות חלב, שהצוואר הוא ור, או אור שהוא אור דק, הוא אור בדרך כלל יבש, ובגלל שהן באדנקסה, גם אי אפשר לבצע פרוצדורות שהן פרוצדורות אגרסיביות. בשביל לטפל בצוואר, וכמובן לטפל, כשאנחנו מדברים על המטרות הטיפוליות, זה לשפר את הקמטים, את המראה הקרפי, לייצר טייטנינג של האור. בדרך כלל צריך לשלב בין מודליטיס. באופן כללי, בקליניקה הזאת אנחנו מציעים הרבה טיפולים, הרבה שילובי טיפולים לצוואר, וזה תמיד משלב בין מכשור לבין חומרים שמוזרקים, לרוב הם חומרים שהם ביוסטימולטורים, או חומרים שהם מה שמוגדרים כביו-רימודלינג אייג'ינג. למשל, אנחנו משתמשים בהייפו, ואז אנחנו מזריקים כהה בצורה שהיא דילוטד. למשל, אנחנו משתמשים בסוגים שונים של גלי רדיו, וחומרים שמבוססי PLLA. במטופלת הזאת, מה שאנחנו הולכים להראות, אנחנו הולכים להראות שילוב של לייזר לא אבלטיבי, ריסורפקס, אורך גל של 1565 ננומטר, ואחר כך הזרקה טיפתית של קריזמה שהיא מעולה. בצוואר אנחנו מאוד אוהבים להשתמש במיהול של 1/1, זאת אומרת, לוקחים את הקריזמה, מועלים אותה 1/1 עם סליין, ומזריקים את זה בטיפות, אתם תראו את הטיפול. לגבי הסימון הטיפולי, בואו תסתכלו על הצוואר. שוב, אתם רואים את הקרפינס מבחינת הסקלות, יש סקלות שונות, שאנחנו מדברים על סקין לקסיטי, אני בדרך כלל מאוד אוהב להסתכל ולהגדיר מה הסקורינג, אז הסקורינג הוא פחות או יותר 2 או 3, אנחנו מדבבים, אנחנו מראים את הסקורינג למטופלת, ואחרי טיפול אנחנו שוב בודקים את עצמנו, אני בדרך כלל לא מבטיח יותר מ-1 point reduction כשיפור בסקור. מבחינת הטיפול, שימו לב, כשאני מדבר על צוואר או טיפולים לצוואר, אני בדרך כלל מסמן את הסימון הבא. אני מסמן את הגבול העליון, הגבול העליון זה בעצם הגבול בין הסאבמנטום לצוואר, אתם רואים את הגבול העליון. הגבול התחתון זה בעצם הקלביקולות והנוטש, כשלגבי הגבול הצידי או האחורי, אני בדרך כלל לוקח אותו קצת יותר אחורה. החלק העליון אני מתחיל מהחלק האחורי של הסטרנוקלאודיומסטואיד, ואני בעצם מעביר איזשהו קו שהוא קו אנכי עד לחיבור של השכמות עם הקלביקולות. For this treatment we're going to use two modalities. The first one is going to be non-ablative fractional laser, and the other one, the second one, will be Karisma. For the non-ablative fractional laser, we chose Resurfaced, which is manufactured by Luminis. So this is the system, this is the M22 or Stellar system. Again, Luminis, it has several handpieces. We chose the Resurfaced. Let's have a look at the screen. So whenever you choose the Resurfaced, you can choose the different parameters. The main ones are the density. It starts from 50 to 500. This is the number of columns per centimeter square. So you can see this is the maximum and the minimum was 50. For this treatment, we are going to choose a moderate density. It's going to be 200 columns per square centimeter. And regarding the energy, it can start from 10 millijoule per pixel, and it can get to 70. Here again we will go low. Again, the neck area is a sensitive, delicate area. We do not want to overtreat. So 230. Regarding the size, again, you can choose different shape of tip. I usually, for the neck area, I like to use the square, and I go either the square or I go with the circle, okay? But here we will choose the square, and I will do one pass, but I will do 10 to 20% of overlap. So this is going to be the first step of the treatment. Immediately after this treatment, we're going to use Karisma. Okay, you can see the square of the treatment, so you can change the window to make it more comfortable. Okay, that's how we do it. So you can see this is a very easy treatment. Usually I delegate this treatment to one of the nurses or skin therapists that work in this clinic. We do one pass, moderate settings, so 200 columns per square meter. We just go over and we cover the whole area. So it's not really felt. There are areas which are more sensitive, for example, this area. But generally speaking, it's a very easy treatment. Now, this system, manufactured by Luminis, is backed up by many publications which showed the efficacy. Now, for the physicians who are less familiar with lasers, as you can see, the epidermis is intact. This is the reason it is called non-ablative fractional laser. And by creating, you can see the redness already, and you can see the swelling. This is the sign that we can monitor where we treated and where we have skipped areas. So it creates zones of coagulation, which will eventually be replaced by new skin. Again, I believe that while combining between non-ablative fractional laser and Karisma, it will have synergy and it will provide us with better result. How painful is this step? Do you feel pain? No. Not really. So as you can see, we covered half of the neck. You can see the redness and the swelling. Here we have some area which were skipped, so we are going to do a second pass. That's perfect. As you can see, this area was covered. You can see the redness and you can see the swelling. Again, easy treatment. So this is half of the non-ablative fractional laser treatment. Let's go to the other half. Whenever you perform a laser treatment, it is true for not just laser treatment, you want to cover in an even way the surface. So again, different physicians will come with different technique. I really like the snake technique, in which I go like a snake. You see, now I'm going backwards usually around 10 to 15% overlap. If you're not sure you covered a certain area, just wait for a few seconds, and then the redness and the swelling will appear, and you can see exactly where you treated and where do you have the skipped area to repeat. As long as I really like this technology, if you do not have this technology at your office and you have another non-ablative laser in the near infrared region, so in the market you have 1540 and you have 1570. Again, you have different technologies. They all can be used with the same technique. You can see this is the area that we finished. Let's go all the way down. You could see the border, you can see the redness, and you can see the swelling. So this area wasn't treated. This is the border of the treatment, so you can really cover your skipped area and the area that wasn't treated. All right, so we finished the first step of the treatment, so we can switch off the laser because of the sound, so you can take off the goggles. Let's switch it off. Okay, and let's go to the second phase. This is the second step of the treatment. We are going to inject diluted Karisma, as we've shown you. This is a 1-to-1 dilution. The dilution was with a saline. The second step, we are going to prepare the Karisma. The Karisma can be injected as is, and we use it as is with a cannula or with the superficial injections. Here we are going to show you this combination, this SNK procedure. So it's going to be injected superficially. So this is the Karisma. I would like you to see how we prepare Karisma for superficial injection. So let's see how we prepare Karisma. So we take the Karisma. The Karisma contains 2 milliliters of human recombinant polypeptide of collagen 1 alpha chain. So we talk about 200 microgram per milliliter of human recombinant collagen 1, which is important, is an important factor, important ingredient of the skin. In addition, it contains 200 milligram per milliliter of non-cross-link high molecular weight hyaluronic acid, and CMC as a stabilizer. So we take the Karisma, the 2 milliliter of Karisma, and we reconstitute it with 2 milliliter cc's of saline. Let's have a look how it is prepared. While being prepared, maybe a few words about the Karisma. Maybe for the more, I would say, younger generation, the younger physician who do not remember collagen-derived biostimulators. So in the past, we had collagen-based fillers or biostimulators. They were derived from bovines and from pigs, and they possessed a series of limitations linked to the onset of allergic reaction and possible infections, and actually they left the market, the aesthetic market. This is an innovative, surprising material, or I would say formulation. As I've said, it is composed of human recombinant polypeptide of collagen 1 alpha chain, high molecular non-cross-link hyaluronic acid, and CMC. And this collagen, because it is not animal derived, it is human recombinant, has 99.9 resembles to human collagen. Thus, it retaining on the one hand the regenerative capabilities, so the ability to stimulate collagen, and it doesn't have the limitation that we had with the animal-derived collagen. The first step of the treatment we finished. You can see the redness and the swelling. So this is the marking, or this is the effect of the laser. We have thousands of columns of coagulation which will remodel. Now, in order to augment the result, we're going to inject the diluted Karisma. We previously prepared the diluted Karisma, and then we changed the syringes into 1 cc syringe, and you can see we use usually 30 or 32 gauge needle. It's very easy, not painful, and let's see how we do the injection. The injection is superficial. We inject into the dermis. We want to see these papules, okay? This is one, and we do it every 8 to 10 millimeter. Stretch your skin, you can see the area of treatment, and then I begin my treatment. You can see the papule, every 1 centimeter. We just go very superficially. It takes, no, you don't have to be an experienced injector. It's very easy. Go superficial. This combination of a non-ablative fractional laser and the injection of Karisma will really improve the skin quality. So this was the first line. Let's carry on. Now, regarding the quantities, usually physicians ask me how much exactly do I inject. Have a look at the end papule. Whenever you see blanching of approximately 2 to 3 millimeter, so you have a 2 to 3 millimeter papule, you stop. It's approximately 0.1 or 0.2 cc's, but again, it shouldn't be, it's not accurate. We change our injection according to the end papules. You can stretch the skin in certain area. It will make it easier for injection. Perfect. Let's go. We covered nearly 25% of the area. Let's go. I remind you that the border is the traps and the clavicle and the superior border of the clavicle. Don't inject deep. You have to inject superficial, and your clue that you know that you injected superficially is that you see the blanch, you see the papules, the white papules. That's it. Let's go to the other side. Again, have a look, the end, where we want to see, the end point. We want to see papule. We want to see white papule, especially after doing the lasers. The papules are very prominent. Every 8 to 10 millimeter, we create a papule. כמעט בסוף. All right. זהו, סיימתי. Okay, so we have just finished the treatment. So I showed you a treatment for neck rejuvenation. The neck area is an important area to treat. Usually people treat the face and they do not treat the neck. And thus we have this correlation between the face and the neck. So I showed you a treatment for the neck area, combining non-ablative fractional laser and Karisma. This is a human recombinant surprising neuroregenerative formulation. This combination of non-ablative fractional laser and Karisma is highly effective. Usually 2 to 3 treatments are needed every 4 to 6 weeks. The results will be supreme.